should you take vitamin D supplements? If so, how much? Vitamin D3 or vitamin D2? Or can we just get it from the sun or from food? I'm going to answer all those questions today and more, so stay tuned. And what's up everybody, CW here from Considerate Health, and today we are talking vitamin D, the sunshine vitamin. Now vitamin D is perhaps one of the most popular vitamins in the last decade, and not without reason. Its popularity has gone up even more so during the pandemic, as it's been shown that those who are deficient in vitamin D tend to be more likely to catch COVID or tend to get sicker. But guess what? This is actually not news. We've known for a long time that those who are deficient tend to be more susceptible to respiratory infections such as the cold or the flu. That's because vitamin D plays a critical role in immune function. It can help dampen inflammation, regulate the intestinal barrier, plays a role in mood disorders like depression, and of course, what it's most well known for is help with bone health and musculoskeletal health. I could go on and on about the benefits of vitamin D, but let's jump into some very common questions. So the first question is, can we just get all our vitamin D from the sun? And the short answer is, for most, it may be very difficult. When UVB rays hit our skin, our body starts the production of vitamin D. But then there's an issue with clothing. Many of us wear long sleeve shirts, long pants, at least for part of the year, if not most of the year. And so there's a lot less surface area for the vitamin D production to actually happen. Now, even if we wear shorts and short sleeve shirts, many of us put on sunblock. We've been taught that sunblock reduces the risk of certain skin cancers, and indeed, that may be so. However, the same mechanism that reduces our risk of skin cancers also prevents the production of vitamin D. Then there's the issue of skin color and age. If you're darker skinned and have more melanin, it's harder for you to make vitamin D. Also, if you're older, you're much less likely to make good vitamin D compared to someone younger. Then there is the issue of weight. If you're overweight, not only do you make less vitamin D from the sun, you're less likely to benefit from supplements. Then there's the issue of geography. If you live north of the 37th degree parallel or south of the 37th degree parallel, during the wintertime you make little to no vitamin D, and during springtime and fall time you make a lot less. Which leads us to the second question, can I just get my vitamin D from food? Yes, but unfortunately there aren't very many vitamin D rich foods. Now, the richest may be certain fatty fish like mackerel and salmon that can contain between 500 to 700 IUs per 100 grams, or that's about 3.5 ounces. And then there are mushrooms. Mushrooms contain a form of vitamin D called vitamin D2. Now, what's interesting about mushrooms is how much vitamin D they contain depends on how much UV exposure they've had. They've done studies where exposing certain mushrooms to UV light for 15 to 45 seconds can increase their vitamin D2 content by 30 to 40 times. That's pretty amazing, and so they can contain up to about 800 IUs per 100 grams. Well, what about dairy? Isn't there something called vitamin D milk? Well, yes, cow's milk is often fortified with vitamin D3, about 200 IUs per glass or 8 ounces, and a lot of the milk alternatives like almond milks, coconut milks, those are often fortified with vitamin D2, about the same amount. As we're going to see though, all these different foods though may fall short of what your body actually needs for an optimal range. Now the third question is, what are optimal blood levels? To determine a right dose for you to take, it's often helpful to know where your levels are at. Now, an important note is that when you get your levels checked, make sure you have the 25 hydroxy vitamin D levels checked, not the 125 dihydroxy vitamin D levels, which is more useful as an indicator for parathyroid issues or kidney issues or other disease states. Now you would think ranges are an easy thing to determine, and yet there are disagreements on this. The Institutes of Medicine, for example, thinks under 12 is considered deficient, between 12 and 19 is considered insufficient, and above 20 is good. Whereas the Endocrine Society thinks under 20 is deficient, and between 20 and 29 is insufficient, and above 30 is good. Now, oftentimes though with these ranges, I think the wrong question is being asked. Not what is inadequate and adequate, but what is optimal. What are optimal ranges? Not just enough to meet regular bone health and general health, but what is good for optimizing immune function. And the range may be closer to 40 to 50, and some experts believe it should be 50 to 80, especially for those with autoimmune diseases. So the fourth question is, well then how much vitamin D do I have to take? Now the recommended daily allowance set by the National Institutes of Health says 400 to 800 IUs of vitamin D, depending on your age. But again, this is minimum ranges, not optimal ones. In the clinic, I have rarely found someone that needs less than 1,000 IUs, and many need to take 2,000 up to 5,000 and some even more than that. Now, general rule of thumb is for every 1,000 IUs of vitamin D that you take, it raises your blood levels by about 10 nanograms per deciliter. So next question is vitamin D3 or vitamin D2? You see, there's two forms of vitamin D. There's vitamin D3 or cholecalciferol, which is made by animals like humans. And then there's vitamin D2 or ergocalciferol, which is made by fungi like those mushrooms we mentioned earlier. Now in California where I live, the prescription form of vitamin D is vitamin D2, and oftentimes that's 50,000 IUs per week. And over-the-counter forms are almost always vitamin D3. Now, which one is better? Well, there's again controversy here. There's been a lot of studies done on this topic, and it seems that some show that vitamin D3 tends to bring up levels better than vitamin D2 in the blood, whereas others conclude they both can raise levels equivalently. However, most do conclude that vitamin D3 tends to keep those levels of vitamin D levels at an optimal range better than vitamin D2. So in general, I'd recommend vitamin D3. Now tablets, capsules, drops, patches, what form is best? Well, vitamin D is a fat-soluble vitamin, so usually in a form that contains some fat may be helpful. So for example, gel caps and drops often contain some kind of oil, whether it be soybean oil, olive oil, MCT oil, that may help absorption. So if you're gonna take a dry tablet, it's best to take it with some food, especially that contains some fat to improve the absorption. Now, what about those patches that people are finding more popular nowadays? Do those actually work? Well, there's actually not quite a lot of evidence yet, but anecdotally, some patients seem to have found some benefit in that it can raise levels. Now, obviously, when in doubt, check the levels to see if it works. Now, the next question is, why aren't my vitamin D levels coming up, even with supplementation? Now, there could be a few answers to this. The first one to look at is just the brand of supplement you're taking. As we know, many supplements are not regulated by the government, and so just changing to a more reputable brand or different company is worth trying first. Also, the form, as I just mentioned, is helpful. Changing from a tablet to a gel cap or a gel cap to drops, that may be all that's needed. I've had patients that just did that and their vitamin D levels started coming back up. The second issue is just you're not taking enough vitamin D. As we've already talked about, many organizations are very, very conservative on what they consider to be safe amount. Unfortunately, those are often inadequate for optimal health, and so increasing the amount may be helpful. Third thing is malabsorption. Now, we talked about earlier some things that can impair your body's ability to produce vitamin D, but there are also things that can impair your ability to absorb vitamin D. As we already mentioned, certain people that are overweight, but also things that include digestive issues like Crohn's disease, celiac disease. So those are certain issues to consider. Now, the next question is, can I get too much vitamin D? Now, from the sun, the answer is no. Our body has certain regulatory systems that prevent us from making too much vitamin D from the sun. But what about from supplements? The thinking is, since vitamin D is a fat-soluble vitamin, it's easy to overdose over time, especially if you're taking higher doses. Now, just keep this in mind. A lot of the studies in the literature involve giving people 50,000 to 100,000 IUs of vitamin D, and safely so. Now, granted, this wasn't for prolonged periods of time, but still, it shows that people can tolerate high amounts of vitamin D. And honestly, in 10 years of primary care practice, I have not seen anybody that had adverse effects from taking too much vitamin D, even when their levels were really, really high. Another thing to keep in mind is that if someone has an adverse effect to vitamin D, it may not be the vitamin D itself. It may be one of the additives, or one of the things is that vitamin D, of course, increases calcium absorption. And if someone's calcium levels go up, then they can have certain symptoms like nausea or vomiting. But again, I haven't seen this in clinical practice. But that's something to be aware of. Another thing is to remember is that vitamins often work synergistically with other vitamins and minerals. So vitamin D is no different. To activate vitamin D to its final form, we need adequate amounts of magnesium. So if you're magnesium deficient, you can actually have some problems or adverse effects. So keep that in mind. Finally, vitamin D, since it can increase calcium absorption, we want that calcium to go into the bones and not the arteries. So it's helpful to have some vitamin K2 with the vitamin D. So there's a lot of products out there that actually combine vitamin D3 with vitamin K2. Now the last question is, who should not take vitamin D? Now, if you have adequate blood levels just from the sunshine and eating vitamin D rich foods, great, you may not need to supplement. However, some people with certain medical conditions do need to exercise caution, and this includes people with kidney failure and are on dialysis, and those that have recurrent kidney stones, and lastly, those with sarcoidosis. And a lot of this, again, circles around having higher calcium levels because the vitamin D increases absorption of calcium. So that's it for vitamin D. What questions do you have, and what is your experience with vitamin D? I'd love to hear your responses. But until next time, be well.